Why you may not be getting your period. The medical term for a lack of menstrual cycles is amenorrhea. It can have many causes. Pregnancy. If you have had regular periods, and then suddenly stop getting your period, you may be pregnant. This is likely the first thing you thought of when your period was late, and you have likely already taken a pregnancy test. But what if your pregnancy test was negative? Could you still be pregnant? Yes. It's unusual, but it is possible to be pregnant and get a negative pregnancy test. See your doctor for follow-up and confirmation, and until you know otherwise, act as if you're pregnant. Avoid alcoholic drinks, for example. Breastfeeding. Exclusively breastfeeding a baby can prevent your periods from coming. How long will you go without a period when breastfeeding? It depends on how often you are breastfeeding and your personal biology. Birth control. Some forms of birth control can stop your periods. Your doctor should have told you if this was possible when they prescribed it. If you want to try to conceive, how long will it take for your periods to return after you stop taking the birth control depends on your body and your contraception choice. With Depo-Provera, also known as the birth control shot, menstrual cycles tend to return about 6 months after the last injection, if you were receiving the injections for at least 1 year. Other medication. Birth control isn't the only medication that can stop your periods. Other medications that may stop your cycles include some psychiatric drugs, chemotherapy, allergy medications, and blood pressure pills. Obesity. Obesity is one of the most common causes of infertility. Women who are obese may experience irregular menstrual cycles and, in some cases, their periods may stop completely. Losing weight may restart or regulate your cycles. Underweight. With obesity, too much fat throws off the normal hormonal balance in the body. If you are underweight, the lack of fat can throw your reproductive cycle off. If this is the problem, bringing your weight up should restart your cycles. Exercise or lack of body fat. You may be an athlete who is neither over nor underweight, based on body mass index. However, it's not your weight that really impacts your reproductive cycle, it's the amount of fat. Athletes may have a high percentage of muscle and a low percentage of body fat. This can cause their menstrual cycles to be irregular or even stop completely. Excessive exercise can also cause your periods to become irregular or stop. Stress. Stress can cause you to skip a period or two. However, it's highly unusual for stress alone to cause your menstrual cycle to stop for months. PCOS. Polycystic ovarian syndrome, PCOS, is a common cause of female infertility. One of the primary symptoms of PCOS is irregular or absent periods. Primary ovarian insufficiency. Also known as premature ovarian failure, primary ovarian insufficiency, POI, can cause irregular or absent periods. Sometimes, a person with POI will go months or even years without a period, only to have them restart without explanation. POI also used to be called early menopause, but that's misleading. After menopause, menstruation never returns. Hormonal imbalance. While PCOS and POI can cause ovulation problems, so can other hormonal conditions. A thyroid imbalance, endometriosis, an underlying untreated medical condition, like diabetes and hyperprolactinemia, can lead to irregular or absent periods. Uterine problems. Structural problems or scarring of the uterus can cause your periods to be irregular or stop completely. This may occur after a dilation and curettage, D&C, or uterine surgery. Menopause. This is sometimes the first fear women have when they suddenly stop getting their period, even if they are years and years away from it becoming a reality. While early menopause is possible, unless you are 45 years old or older, it's unlikely menopause is the cause for your lack of periods.